Hi, everyone, this is a detailed video of mine about chlamydia infection. Well, chlamydia trachomatis is a common sexually transmitted infection, STI, caused by bacteria. You might not know you have chlamydia because many people don't have signs or symptoms, such as genital pain and discharge from the vagina or penis. Chlamydia trachomatis affects mostly young women, but it can occur in both men and women and in all age groups. It's not difficult to treat, but if left untreated, it can lead to more serious health problems. Now let me tell you the symptoms. Early-stage chlamydia trachomatis infections often cause few or no signs and symptoms. Even when signs and symptoms occur, they're often mild, making them easy to overlook. Signs and symptoms of chlamydia trachomatis infection can include painful urination, vaginal discharge in women, discharge from the penis in men, painful sexual intercourse in women, and bleeding between periods and after sex in women. Testicular pain in men. Chlamydia trachomatis can also infect the rectum either with no signs or symptoms or with rectal pain, discharge, or bleeding. You also can get chlamydial eye infections, conjunctivitis, through contact with infected body fluids. See your doctor if you have a discharge from your vagina, penis, or rectum, or if you have pain during urination. Also, see your doctor if you learn your sexual partner has chlamydia. Your doctor will likely prescribe an antibiotic even if you have no symptoms. Now let me tell you the causes. The chlamydia trachomatis bacterium is most commonly spread through vaginal, oral, and anal sex. It's also possible for pregnant women to spread chlamydia to their children during delivery, causing pneumonia or a serious eye infection in newborns. Now let me tell you the risk factors are. Factors that increase your risk of chlamydia trachomatis include being sexually active before age 25, having multiple sex partners, not using a condom consistently. History of sexually transmitted infection. Now let me tell you the complications. Chlamydia trachomatis can be associated with pelvic inflammatory disease, PID. PID is an infection of the uterus and fallopian tubes that causes pelvic pain and fever. Severe infections might require hospitalization for intravenous antibiotics. PID can damage the fallopian tubes, ovaries, and uterus, including the cervix. Infection near the testicles, epididymitis. A chlamydia infection can inflame the coiled tube located beside each testicle, epididymis. The infection can result in fever, scrotal pain, and swelling. Prostate gland infection. Rarely, the chlamydia organism can spread to a man's prostate gland. Prostatitis can cause pain during or after sex, fever and chills, painful urination, and lower back pain. Infections in newborns. The chlamydia infection can pass from the vaginal canal to your child during delivery, causing pneumonia or a serious eye infection. Ectopic pregnancy. This occurs when a fertilized egg implants and grows outside of the uterus, usually in a fallopian tube. The pregnancy needs to be removed to prevent life-threatening complications, such as a burst tube. Chlamydia infection increases this risk. Infertility. Chlamydia infections, even those that produce no signs or symptoms, can cause scarring and obstruction in the fallopian tubes, which might make women infertile. Reactive arthritis. People who have chlamydia trachomatis are at higher risk of developing reactive arthritis, also known as Reiter's syndrome. This condition typically affects the joints, eyes, and urethra, the tube that carries urine from your bladder to the outside of your body. Now I should throw some light on the preventive measures. The surest way to prevent chlamydia infection is to abstain from sexual activities. Short of that, you can use condoms. Use a male latex condom or a female polyurethane condom during each sexual contact. Condoms used properly during every sexual encounter reduce, but don't eliminate the risk of infection. Limit your number of sex partners. Having multiple sex partners puts you at a high risk of contracting chlamydia and other sexually transmitted infections. Get regular screenings. If you're sexually active, particularly if you have multiple partners, talk with your doctor about how often you should be screened for chlamydia and other sexually transmitted infections. Avoid douching. Douching decreases the number of good bacteria in the vagina, which can increase the risk of infection. Coming to the diagnosis, the Centers for Disease Control and Prevention recommends chlamydia screening for sexually active women aged 25 or younger. The rate of chlamydia infection is highest in this group, so a yearly screening test is recommended. Even if you've been tested in the past year, get tested when you have a new sex partner. Pregnant women. You should be tested for chlamydia during your first prenatal exam. If you have a high risk of infection, from changing sex partners, or because your regular partner might be infected, get tested again later in your pregnancy. Women and men at high risk, people who have multiple sex partners, who don't always use a condom, or men who have sex with men should consider frequent chlamydia screening. Other markers of high risk are current infection with another sexually transmitted infection and possible exposure to an STI through an infected partner. Screening and diagnosis of chlamydia are relatively simple. Tests include a urine test. A sample of your urine is analyzed in the laboratory for the presence of this infection. A swab. For women, your doctor takes a swab of the discharge from your cervix for culture or antigen testing for chlamydia. This can be done during a routine pap test. Some women prefer to swab their vaginas themselves, which has been shown to be as diagnostic as doctor-obtained swabs. For men, your doctor inserts a slim swab into the end of your penis to get a sample from the urethra. In some cases, your doctor will swab the anus. If you've been treated for an initial chlamydia infection, you should be retested in about 3 months. Now let me tell you the treatment. Chlamydia can usually be effectively treated with antibiotics. More than 95% of people will be cured if they take their antibiotics correctly. You may be started on antibiotics once test results have confirmed you have chlamydia. But if it's very likely you have the infection, you might be started on treatment before you get your results. The 2 most commonly prescribed antibiotics for chlamydia are doxycycline, taken every day for a week. Azithromycin, 1 dose of 1 g, followed by 500 mg once a day for 2 days. Your doctor may give you different antibiotics, such as amoxicillin or erythromycin if you have an allergy or are pregnant or breastfeeding. A longer course of antibiotics may be used if your doctor is concerned about complications of chlamydia. Some people experience side effects during treatment, but these are usually mild. The most common side effects include stomachache, diarrhea, feeling sick, and thrush in women. A patient may ask the question, when can I have sex again? If you had doxycycline, you shouldn't have sex, including vaginal, oral, or anal sex, even with a condom, until both you and your partner have completed treatment. If you had azithromycin, you should wait 7 days after treatment before having sex, including oral sex. This will help ensure you don't pass on the infection or catch it again straight away. Okay, this was my video about chlamydia infection. I hope you will like this video. If you have any questions, please post in the comments section. Thanks for watching this video. See you in the next video. Bye for now.